Hello everyone, my name is Ranota Morgan and today I will be presenting a speech to you on post-op wound care instructions. As my audience today, I have my neighbors, Tamika Bacon. Thank you, Miss Bacon. Also, I have Miss Denia Williams. Thank you, Miss Williams. As I stated before, I will be giving you a speech on post-op wound care instructions, especially for patients, who's diabetic, or any patient that has had an artificial joint, such as a knee or hip replaced, an artificial heart valve, a pacemaker or defibrillator. Reason being because these patients normally have a higher risk of catching an infection than a normal person. The initial bandage that's put on your wound after your surgery should be left there for 24 hours. Within that 24 hours, we ask that you do not take a bath sitting down, which will be in standing water, get in any kind of swimming pools, hot tubs, or submerge the wound in standing water. We ask that you take that bandage off after the 24 hours and clean the wound. Normally, cleaning the wound just includes taking a normal bath. You can wash the wound with any kind of antibacterial soap or clean it with any kind of sterile water or peroxide. We also ask that you keep the wound moist, that includes using Vaseline, Aquaphor, or Neosporin. We ask that you change the bandage every day and keep it moist for 2 weeks until you come back to get your sutures removed. After you get your sutures removed, depending on how your wound looks, we will apply steri strips or we will just let it heal in. Patients that have diabetes or have had any kind of other health issues normally are put on antibiotics to prevent infections. A patient that's a diabetic or a patient that has an artificial joint, things could get really bad for them if they get an infection, such as amputations, hospitalizations, IV antibiotics, things of that nature. So it's very important for a diabetic patient or a patient that has other health issues to properly care for their wound and keep their eyes open for signs of infection. Signs of infections include redness, anything that's bloodshot red, any excessive bleeding. If your wound starts to bleed, you should hold pressure for at least 20 minutes. After those 20 minutes, if it's still bleeding, you should contact your physician immediately. Other signs of infections is pussing or oozing. If your wound starts to pus, especially a different color like an orange or a greenish looking color, that's a sign of infection. Anything swelling that's double or triple the size of your normal body area, that's a sign of infection. Any kind of red streaking that's coming from the wound is also a sign of infection. You should contact your physician at any time if you see any of these signs. Also, when caring for your wound, it's very, very important not to let your wound brush up against things such as your covers, maybe if you're in the kitchen making dinner, not to let anything get into your wound. We have a lot of people that thinks just because they have a little gauze or a little band-aid that things won't get into it. But just think, if you're in the kitchen cooking and you wash your arm or you wash your hands and that band-aid is moist, it's not going to stick properly. So that could lead to an infection, especially if you're in the kitchen and you're dealing with like raw meat or anything of that nature. After that, you'll come back in 2 weeks to get your sutures removed. Once the sutures are removed, we still ask that you be careful because the wound is still able to pop open because the sutures are removed. We ask that you continue to monitor your activity, not to do any rough pushing or pulling. If you work around a lot of tension area, or if your wound, is in a high tension area, We ask that you follow strict restrictions from your job just for your safety.